Anyone suspected of traveling with migrants in Texas will be stopped and turned around. It's part of Governor Greg Abbott's new order restricting transportation of migrants due to the COVID-19 pandemic. The order allows DPS to stop any vehicle upon reasonable suspicion of carrying migrants and to reroute them to wherever they came from. They're also allowed to impound cars that violate that order. Abbott says the unlawful crossings have led to a dramatic rise in COVID-19 cases, but the ACLU of Texas is calling it another assault on civil rights. Well, the group released this statement saying in part that, quote, the order will lead to racial profiling and over-policing, with state troopers pulling over cars and buses without lawful justification, end quote. Well, dozens of Texans you see right there, along with former Democrat Congressman Beto O'Rourke, are leading a 30-mile voting rights march. It started yesterday in Georgetown and will end this weekend at the state capitol in Austin. O'Rourke and his voter outreach program called Powered by the People has partnered with Reverend William Barber and the Poor People's Campaign to host this march. They say it's all in an effort to combat voter suppression in Texas and around the country. They're also pushing to pass all provisions of the For the People Act. This legislation would touch on virtually every aspect of how elections are conducted. Well, some Texas hospitals are updating their visitor policies as COVID-19 variants continue to spread throughout the state. In Amarillo, for instance, Northwest Texas healthcare system removed most of its waiting room furniture and capped waiting spaces in its facility. In Lubbock, UMC Health System allows 2 visitors for non-COVID patients. Baylor Scott & White, which has locations in North and Central Texas, is limiting visitors to 1 guest in most situations.
We're trying to protect our patients, we're trying to protect our staff, we're trying to protect their family members, and so they're all done out of a place of trying to, as best we can, manage the spread of COVID even within our facilities.
Most places are not allowing visitors for COVID-19 patients. Roughly 5,000 Texans are currently hospitalized because of COVID-19. That's the most since early March. Well, as the Delta variant spreads rapidly across the country, the federal government is scrambling to contain it. The CDC has reversed its mask mandates and says in order to try and help decrease the spread to others. Our own Washington correspondent Alexandra Lamont joins us now live to talk about that and reports that President Biden is expected to deliver remarks today on what other steps the federal government will take. Good morning, Alexandra.
Morning. That's right. Today, President Biden is expected to announce a requirement for all federal employees and contractors to be vaccinated or submit to strict regular COVID-19 testing. As the number of COVID-19 infections spikes because of the Delta variant and the number of people getting vaccinated is stagnant, the White House is now considering stronger action, like a vaccine mandate for the federal workforce.
The pandemic we have now is a pandemic of the unvaccinated.
Earlier this week, the Department of Veteran Affairs became the first federal agency to implement a COVID-19 vaccine mandate. California and New York State also implemented their own vaccine mandates for state employees, or those employees can submit to regular testing instead.
I think we need dramatic action to get control of this situation.
According to the CDC, 69.3% of adults have received at least 1 dose of the COVID-19 vaccine. That number is still just shy of the 70% President Biden wanted to reach by the 4th of July. This week, the CDC also reversed recommendations on mask wearing, saying even vaccinated adults should wear masks indoors in areas of high spread. Republicans on Capitol Hill are critical of that decision, saying it could hurt efforts to vaccinate more Americans.
People will say, whoa, so you're telling me the vaccines aren't really effective? Well, then I'm not going to get one. So I think this is a mistake.
This week, the Department of Justice also cleared the way for private sector employers to require vaccines as a condition of employment.
Well, quick question for you, Alex. While we're following all of that, big news on Capitol Hill last night when it comes to the Senate finally taking some action on the really talked about infrastructure deal. Can you give us more info on what happened?
Yeah, so while a small group of senators has been working now for months behind the scenes to try to get this infrastructure bill together, last night the Senate voted to approve to approve for the full Senate to begin working on that infrastructure bill, officially begin amending it. And so we're talking about the $1 trillion infrastructure bill here that would invest in roads, bridges, and traditional infrastructure. It does not include moving forward with the $3.5 trillion that the president wants to invest in what he calls human infrastructure.
All right, good to know. All right, that's Alexandra Lamont reporting live for us from Washington, D.C. We'll see you later in the show as well. Thank you.